The FDA is reportedly considering stricter guidelines for the emergency authorization of a COVID vaccine. Are you okay with that?
Well, I tell you what, we're looking at that. That has to be approved by the White House. We may or may not approve it. That sounds like a political move.
President Trump, during his briefing yesterday, once again injecting himself into the science as he blames the FDA now, of all people, for playing politics. That comes as more and more people losing faith in the government's vaccine push, including New York Governor Andrew Cuomo.
So the first question is the vaccine safe? Frankly, I'm not going to trust the federal government's opinion. And I wouldn't recommend to New Yorkers based on the federal government's opinion. We're going to put together a group for them to review the vaccine so I can look at the camera and can say to New Yorkers that it's safe to take.
Only a little more than half now say they would take it when it's ready. I should note that in March, nearly 3/4 said that they would have gotten the shot at that point. And now, the most trusted infectious disease experts, they're becoming more and more marginalized. A new report out says that Dr. Deborah Birx, she's thinking of resigning from the coronavirus task force because of her now diminished role. We know that Dr. Anthony Fauci continues to get criticized by the president. And speaking of Dr. Fauci, he was on Capitol Hill also yesterday testifying about the outbreak, and he got into it with a denier of COVID, if you will, Kentucky Senator Rand Paul.
You've lauded New York for their policy. New York had the highest death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. The things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together.
Or they've developed enough community immunity
Right.
that they're no longer having the pandemic.
In New York, it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
And that's about as aggressive as a Dr. Fauci will get. So as the roles of Drs. Fauci and Birx shrink, people like Dr. Scott Atlas, they're getting more face time with the president. Who is he, you ask? He's a radiologist with no background in infectious diseases. And it should be noted that 78 of his former colleagues at Stanford Medical School just wrote an open letter denouncing Atlas, saying he spreads falsehoods and misrepresentations of science. Their words. But he, one of the key guys now that the president is relying on. I want to bring in our guest to discuss, Dr. Amesh Adalja. He is a senior scholar at the John Hopkins University Center for Health Security. He's also an emergency medical physician himself. And doctor, I wanted to talk to you because obviously we passed a milestone and we've become so inured to so many bizarre things lately that 200,000 isn't just a round number. It should, I think, shake us to our core that we've lost that many Americans in such a short period of time to this virus. And I know it's more than that to you because you've been in the ERs. You've known colleagues impacted by this. You've seen people lose their lives to this. Can you put in context just how seismic that is and how we're not even remotely close to being done with COVID?
When we pass this 200,000 milestone, you have to really think, was it all necessary? Did it have to be this bad? And I think the answer is no, because if there were actions that were taken in January, February, and March, we could have had a different trajectory. We could have protected vulnerable populations. We could have avoided costly economic shutdowns. We could have fortified our hospitals with personal protective equipment and not had shortages. But what we saw in January, February, and March was wide-scale evasion, just a failure to realize what this was going to mean, and even some, I would say, outright nihilism, if you look in here about the efforts to minimize or play it down. That really was just what led us to this 200,000 case count. And if we still continue to make the same mistakes, if we still are unable to test, trace, and isolate, that number will go up. And I think it's important to remember that when we think about why this happened, we have to look at the leadership and the responsibility that that leadership has to do a core function of government, and it's failed over and over again.
As I mentioned before, in addition to being in academia, you're on the front lines too. And I'm curious, when you heard this exchange between what the president was telling privately to Bob Woodward and what he was saying publicly to the rest of us.
It's also more deadly than your even your strenuous flus. People don't realize we lose 25,000, 30,000 people a year here. This is more deadly. This is 5 per. This is 5% versus 1% and less than 1%. So this is deadly stuff.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though. We have 12 cases, 11 cases, and many of them are in good shape now.
Doctor, you went on to say, and I know you heard it, that how it can be transmitted. He talked about how children weren't invulnerable to this, but yet publicly he said all the opposite things. We know where he stands on masks. He's recently given himself an A+ on the handling of this, and he's told the American public we've turned the corner when all of science is something different. I always thought he just never bothered to listen, or he didn't know. But he knew and said something different. And again, I'm going to try and put you back into the ER. When you were going through what you were, and your colleagues were as well, to know that he knew, what was your reaction?
It's really mind-boggling, and it's the exact opposite characteristic you want in a leader. You want the leader to be transparent with the public. You want them not to panic the public, but to give the public the truth. But instead, what we saw during the height of this pandemic is undermining of expertise, sidelining of the CDC, attacks on experts. We saw basically an unreality bubble be created by the president and people forced to live in it when we know what was going on. We knew that this was much more severe than influenza. We saw the death rates. We saw what was happening with how quickly this could spread through nursing homes. We knew all of that firsthand. And so I think it's something that many of us thought maybe there wasn't an acknowledgement of what this meant, but now we know that there was an acknowledgement, and then basically a refusal to act, a refusal to take action based upon what the data was showing. And I think that's even more damning than someone who is ignorant.
Hopefully sooner than later, there will be a safe vaccine that we can give to ourselves and our families. But when you hear the president saying that he's going to override the FDA, that he'll make the decision, you got a Dr. Atlas who believes in herd immunity as his lead, voice in his ear right now. I understand why you don't have to just be some anti-vaxxer, but have healthy skepticism that politics is now not driving our science. This is not a healthy place for us to be.
What we've seen is an undermining of the trust in our public health agencies from the beginning. And we've seen meddling in that process at the FDA when it comes to hydroxychloroquine and convalescent plasma. So it is completely understandable that people are hesitant about this vaccine, because you see these phrases about an election surprise or an October surprise, or having a vaccine available very quickly, or him trying to make a decision that the FDA should really be making. All of that makes it much more likely that people are going to balk at this vaccine. We know even during H1N1, which was a tried and true flu vaccine, that 23% of Americans, that's a very low number, that's all that got that flu vaccine. We cannot expect to get any control of this virus if we have such a low vaccine uptake. So we have to make sure that we go through the proper steps, that this vaccine, when it gets emergency use authorized, that it's not been politically meddled with, that we have data that shows that it's safe, that it's efficacious, and in what groups it is safe and efficacious in.
Dr. Adalja, appreciate the time. Thank you so much.
Thank you.
Up next, mourners lining up at the Supreme Court to pay their respects to late Ruth Bader Ginsburg today. After the break, we'll show you more about her remarkable life and also her unlikely friendship with late Justice Antonin Scalia, a man on the opposite side of the political spectrum.